Hey A&Pers, this is Dr. Jones checking in. This is A&P 1 Lab Test 2 video, I don't know, I think we're on 17. So I am done making videos, but I am waiting for my ride. So I thought we'd make a bonus review video. So let's start with what we can see of the skull. I have a pointer. You can see the pointer. All right. Name that bone. Frontal bone. Name the bone. Parietal bone. Name the bone. Temporal bone. Name the bone. Zygomatic bone. Name the bone. Maxillary bone. Name the bone. Whoops, off screen. Name the bone. Nasal bone. Name the bone with a hole in it. Lacrimal bone. Excellent. Name the bone. Whoops, mandible. Name the bone. Hyoid. Name the region of these bones. Cervical. Name the region of these bones with ribs on them. Thoracic vertebrae. And then name this region of bones without ribs, lumbar. And name the bone. Sacrum. Name the bone. Coccyx. How do you spell it? C-O-C-C-Y-X. Excellent. All right, back out. Name the bone. Sternum. Name the structure. Manubrium. Name the structure. Body. Name the structure. Xiphoid process. How do you spell it? Xiphoid process. Excellent. Name the bone. Clavicle. Name the region or end. Sternal end. Name the region or end. Acromial end. Name the structure. Well, that's the acromion. Name the, let's get George Filleton the skeleton to turn around. All right. Name the bone. Scapula. Name the structure. Spine. And it ends up here at the acromion. And name that divot right there. Scapular notch. Excellent. And then back to the front. Name this little C-shaped bit. This is the coracoid process. And name that indent right there. That is the glenoid fossa. Okay. Name the bone. Humerus. Name the structure. Head. Name the structure. Deltoid tuberosity. Now let's, okay. I'll ask the question on the back first. Name that indent right there. That is the olecranon fossa. So we're looking at the back, and that's, here's the head, so that's necessarily medial. That makes this the medial epicondyle, and that makes this one the lateral epicondyle. Okay, I'm gonna turn George around. All right, George. And from the front, what's this little indent right here? The coronoid fossa. And what is this pulley-shaped bit? Trochlea. And the lateral bit, which is like a little orange little hemisphere, the capitulum. Okay. And name this type of rib. Vertebrosternal. Name this type of rib with the green. Vertebrochondral, because it ends at cartilage, and chondro means cartilage. And name the type of rib, these two. Vertebral. And remember, true, false, and floater are not for credit in any way, shape, or form. What is this structure? An intervertebral disc. And which structure is this? The vertebral body. What is the part in the back? Oh, fingers in the way. What is the pointy part? Okay, it would help if I just looked at it because I can't find it in the screen. What are these? These are the spinous processes. They are necessarily posterior. This will be a transverse process. And what's this? It is a costa, or a rib. Okay, sorry. There we go. So these three bones together are a pelvis. And this bone in the middle of the pelvis, sacrum. And then the little tailbone at the end of that is the coccyx. And how do you spell coccyx? C-O-C-C-Y-X. Okay, what is this crack with a pointer in it? Sacroiliac joint. What bone is this? Ilium. And what is this? Iliac crest. What is this big indent right here? That is the greater sciatic notch in the ilium, and this is the lesser sciatic notch, which is right next to the ischial tuberosity, which is the butt bone where you sit down. So what is this hole in the bone? Obturator foramen. And what is this joint right here between the two pubic bones? Oh, guess what? Those are pubic bones. This is the symphysis pubis, or pubic symphysis. Okay, backing out. All right, name this bone. That is the femur. This is the head, neck, greater trochanter, lesser trochanter. Okay, and what bone is this? The patella. And what are these two medial bones? Medial is the tibia. And what's this inferior structure on the tibia? The medial malleolus. And what bone is lateral? The fibula. And what is the distal structure on the fibula? The lateral malleolus. So see, the tibia is medial and has the medial malleolus. The fibula is lateral and has the lateral malleolus. Now, I want to warn you that the pictures in your books are lefts. And the pictures and the models that we have are rights. Oh, that toe is completely out of joint. That's gotta hurt. Okay, what is this bone? It's the talus. And what is the heel bone? You can see that one better, the calcaneus. Anterior to the talus is the navicular. And these three bones, anterior to that, behind the first three metatarsals, are the cuneiforms, and that cube-shaped one is the cuboid. And these are the metatarsals, Roman numeral 1, 2, 3, 4, and 5. And then these bones are all as a group called phalanges. Excellent. Okay. Got a right hand palmar view here, so let's cover this. This is the scaphoid, lunate. That one you can just barely see. Triquetrum, pisiform. At the base of the thumb, trapezium. The base of the first finger, trapezoid. The base of the middle finger, that's how you decapitate someone, with a capitate. And we got a hook. And the hook goes this way. So the hook is the hamate. And then these 5 bones together are called the metacarpals. And they're numbered 1, 2, 3, 4, and 5, thumb to pinky. And then the fingers and the thumb bones are all as a group called phalanges. Phalanges. Excellent. Oh, did we cover, sorry, what is that bone? The hyoid. Excellent. Excellent. Do you agree, George? George Felleton the skeleton agrees. This has been a review video for A&P 1 Lab Test 2. Dr. J out.